Okay, so for this table tie massage routine, we're gonna start with our client face down on the table. Here I'm working into the backs of the legs just as a warm-up technique. Doing some compression moves on the back of the calf and in the back of the hamstring. Just rocking my shoulders back and forth and repositioning the weight of my upper body into straight arms. What I'm doing is I'm pressing into the muscle, and then I'm sliding that muscle away from the bone and the fascia that it's normally attached to. This is a good warm-up because you start to warm up the muscles, loosen the fascia, loosen the connective tissue, and we're introducing movement into the legs. I like to rock the ankles back and forth. From the ankle, you can control the entire leg and start to loosen up the hip joint as well. So here, at the same time that I'm rocking the ankle back and forth, I'm going to start doing some presses in the back of the hamstring. This is sort of a pin and stretch move, very gentle and easy, where you're pressing the hamstring muscle and using the ankle to bow the hamstring underneath your palm where the pressure is. I like to think of this as a isolated stretch. So instead of stretching the entire hamstring, which a lot of people have issues with, stretching their hamstrings, you can pin a very specific point in the hamstring muscle and stretch it laterally instead of elongating it. And that can be quite satisfying for somebody who has tight hamstrings. I'm also going to work up into the hips, at the same time pressing into the bottom of the calf and the ankle. And I'm just going back and forth, imagining like we're just creating space in all the joints. Make sure you do this on both sides. You can do more inner hamstring or inner thigh work from the opposite side of the table here. This is really easy on my body. I'm not using my triceps, I'm not pressing. I'm trying to preserve my energy here by just rocking back and forth. This rhythmic rocking motion, applying pressure. Not worrying too much about whether the client is going to a place of too much pressure. I'm using a very wide part of my palm here. So it's less about pressure points and it's more about just moving the muscle around. And I can use my whole upper body weight. And the client's not going to feel too much pressure here. So after you've warmed up the body, the lower legs, you want to drape both legs in a way that allows for movement of the legs in any different direction, and there's not going to be any exposure. So I'm going to move her arm out of the way here, and I'll show you again. What I do is I find a pinch point right where the ankle is and a pinch point right where the hip is, and I'm just going to move that across. So there's all this extra top sheet to work with, and I'm just going to tuck it right on the inside of the knee. So from here, I'm going to use my outside arm, the arm that's closest to the back, and I'm going to reach through underneath the knee and let their ankle rest on my shoulder and my arm like that. Here, their leg's not going anywhere. I have total control of that, and I can lift up her knee with my right hand. I'm going to reach underneath the knee, grab a piece of sheet, and just slide it up forward, nice and quick. And here we have a really secure drape up to the upper thigh. And we're going to do this on the other side as well. I'll move her arm to the side. Finding those pinch points, moving the sheet in. And I'll do the same thing. Using the outside hand, I'm going to go underneath the leg. Her ankle's not going to go anywhere. And I'm going to reach underneath and pull forward just like on the other side. Here we have plenty of coverage, and the sheets are not in the way when you go into some of these more Thai stretching techniques. So I like to start by lifting her legs up by the knee, and we're just going to rock back and forth. I like to take the inside foot, so the foot that goes towards the inside, that's going to go more diagonally towards the top of the hamstring, while this leg comes out to the side more. So it's going to look kind of like that, and on this side it's the opposite, where the inside foot goes diagonal, the outside foot goes laterally outside. And we're just going to get into a rhythmic flow here. I'm not pushing too hard on the limit of her flexibility with this. I'm just creating a rhythm, helping the client get comfortable with having their legs move in different directions. When I'm working with a client who hasn't had Thai work or stretching work done, it can take a while for them to start to feel like they're letting go and letting me control their legs. So I'll just go back and forth until I start to feel like they've got some trust in me. So once their legs are nice and loose, I'm going to go into a full stretch of this same move, where you place the foot on the inside center line of their hamstring, and the foot is going to come across. I'm going to press the top of the foot, not pressing the skin outward too much. I'm just positioning the foot down, pressing into the hamstring, and with this leg pushing at the top of the ankle, not outside of the foot, top of the ankle, I'm going to press out. Hold for about 6 to 10 seconds, and then we're going to move to the other side, do the same thing. It's okay if their hips come up off the table. Do that a couple times on each side. And each time you can press a little bit harder as their muscles and their joints start to warm up. After you feel like you've completed that portion, we're going to go into a quad stretch. Give it a little jumble here. Make sure that the skin is not bunched up underneath their quad, because it can be really annoying to have your quad stretched and all this skin is caught underneath, not allowing for this full stretch to happen. So you want to make sure the skin is not caught underneath, and I like to make sure that when I'm positioning my hands on the feet, I go palm on the back of the top of the toes, reach around and push those toes forward so you're getting a stretch in the top of the ankle and in the tibialis. I'll do that on both sides. And press. When you're working with somebody that you've never worked with before, you want to go really slow here. Maybe even check in with them on how much pressure they're comfortable with in this stretch. Make sure they're not feeling any lower back pain with this stretch either. It's nice to do these stretches a couple times, so I'll bring the legs back, loosen things up, and do another press here. Okay, now we can let the leg go that we're not going to work on and start to get into some calf and ankle stretches. Here's when I stand up, and I'm just going to position my feet close to the bottom of their knee. Make sure that their foot is nice and secure in your hand. And I'm going to rock back and forth. I'm not putting too much pressure on the calf with this stretch. At this point, I'm just introducing movement, joint mobility into the calf and then the ankle. I also like to position the bottoms of my fingers in between the pinky toe and the second to the pinky toe, right in that joint right here. I'll give a nice press, and I'll do the same thing with my other hand in between the big toe and the second toe. And you can feel the muscles in between those toe joints expanding, contracting, stretching underneath your finger. And so you're getting a nice pin and stretch happening on the top of the foot, as well as a stretch happening in the calf. After I've done this a few times, I'll go into a big stretch in the calf. Here I'm putting quite a bit of body weight. Loosen that up, go in for another big stretch, go a little bit deeper this time. You'll be surprised on how much pressure you can apply into this stretch. If you think about it, the Achilles tendon is one of the strongest tendons in the body, if not the strongest. And instead of stretching the femur against the hips, you really have very little leverage with a short, how short the feet are and how strong the Achilles tendon is. You really have to push quite hard in order to get a satisfying stretch. So I'm putting quite a bit of body weight here. Shake it out, get some blood movement. Do some lateral stretches side to side. Get those tendons in the side of the ankle stretched out. You can twist the foot, so if you place the base of your thumb into the top of the pinky and grab the outside of their big toe on the bottom here, you can twist the foot at the same time pressing out of the heel, and you can stretch all the tibialis, all these tendons on the outside of the foot and all the tendons in between the foot. Finding different places to apply pressure at the same time with all this movement feels really nice. Passive movement is key for these techniques. It helps the nervous system relax. When they realize that they don't have to apply any actual force in this moment where we're moving their joints through their full range of motion, it can be very relaxing. So now that you have the foot up in the air, we can work into the hamstring as well. So from here you can press into the center line of the hamstring with your inside hand, and you have a couple different ways you can move the leg in order to stretch those muscles in the back of their hamstring. So I can go side to side, and you can feel these long muscles and tendons sliding underneath your palm. You can also come out like this and elongate the hamstring muscles. The closer you are to the top of the hip, the more pressure you can apply. So here, I can put my entire body weight into the back of her hamstring. The closer you get to the knee, the more sensitive it is, so you want to be careful coming in closer. You're being really slow and gentle, finding their limit with that pressure. If you're working with a bigger client, somebody who lifts weights, or somebody who does a lot of standing with their work, somebody with more adipose tissue, in order to save your wrists from pressing too hard, you can use your knee. So here, I do the same thing where I just press my knee into the back of their hamstring. Finding that stretch limit. Again, in the center line, be very careful with your knee. You're not using too much of a sharp point. I'm really just using this flat part. I'm not using the kneecap. I'm using the flat part of my knee to apply pressure. While you're up here, you want to do both sides. So I just did this one side, but when you're working on a client, make sure you do everything you do on one side to the other side. After you've finished doing calf stretches and hamstring stretches and compressions, we're going to move into what is essentially a halfway side lying position. So instead of having your client turn all the way to the side, we're just going to lift their knee to the side of the table. And so the way we do that, make sure they're still draped all the way. You're going to grab their knee like you did with the draping. Make sure everything is nice and tight. Grab the bottom of the sheet, the top of the sheet. And here, we're going to drive the knee towards their center line. We're not lifting too much. At the same time, we're just sliding it across the table. So I'm going to use my hand here to press. At the same time, supporting their ankle with my elbow. I'm just going to press them forward like this. Make sure they're nice and tucked. And you want to get that knee to a 90-degree angle. From here, you can keep their foot from falling off the table by pressing here, and we're just going to go into some IT band presses. Work your way up into the gluteus medius, the tensor fasciae lata, gluteus maximus, piriformis. With the surface area of the palm of your hand, you can apply pretty much your entire body weight into most clients. And you want to give them the confidence that you know what you're doing with pressure, so you don't want to be too timid here. You don't want to just, barely go in there. You want to find where their stretch limit is and just hold it there for a couple seconds in different points. And what we're doing here is warming up the side of the hip. Tensor fasciae lata and gluteus medius are places where a lot of people hold a lot of really significant tensions. After you've done a few presses and you feel like your client's muscles are warmed up in this area, you're going to find where the head of the femur, the trochanter, is. So there's this ball of bone here at the top of the leg, and there's the iliac crest, that's the bone which is the top of the hip bone. Find those two bony landmarks, and right in between is the TFL, the tensor fasciae lata, and the gluteus medius. You're going to place the flat part of your elbow right into that zone, We're doing pressure points hold here for about 10 seconds at each point. When I start to work into these areas, for me to know how much pressure is appropriate, I'll go very slow, find the right spot, and apply pressure slowly until I see that a big deep breath happens. That's how you know that you're finding a very satisfying point of pressure with your client. This is a great position to work into those side and front hip muscles, because when the knee is up like this, those muscles are shortened. And when the leg is back and you try working to those places, you'll find that they're very tense and taut. The muscles are in a lengthened position, but when you shorten that muscle, it gives you a lot more access and depth into those deeper tissue areas. We're going to use the iliac crest and we're going to use the sacrum to guide where the elbow goes. So you have two landmarks. You have the trochanter and you have the iliac crest, and then you also have the sacrum up here. So you can find different points to press. If you feel on the outside of your elbow, the iliac crest here, press in, move up, feel the sacrum, press in, not pressing directly into the bone, but just below it. When you get to the bottom of the sacrum, that's where you're going to find the piriformis muscle. And you want to be careful here because that's going to be a really sensitive place for a lot of people. And you can do the same thing with the trochanter, where you start at the base and you work your way up, feeling the trochanter on the inside of your elbow all the way around. And right when you get to that point where it's directly above that 90-degree angle where the leg is facing, you don't want to explore too much with the elbow past that, because then you have the sits bones and it can be a very bony, pinchy area. I like to work into those areas with my fingers. They're much smaller. If you want to take this move even further and go into a more advanced variation, from here I lift the client's knee in the air, supporting also the ankle. I'm going to slide my knee in and get my body as close towards the bottom of their trunk as possible, so that their calf and their tibia is nice and pressed in against my stomach, and you get a little bit of a stretch here in the quad, and you can work into the IT band with flat part of your elbow. You never want to go too sharp with the IT band. We're just going to work different points of the IT band. Rocking back and forth, rhythmic. You'll find right about at the center of the thigh is where the IT band starts to move more towards the top of the femur bone. So you'll feel a little bit more of a bony area right here. Avoid pressing directly into that femur, right? You want to stop pressing straight down right about halfway. So you find yourself right here, the muscle starts to thin out, and then you have all this bony area. From here you can work from a lower position to work into the hamstring. And you can also work into an area just above the femur, and that's where you're working into the quad, which turns into the TFL and glute medius. I like to support with the table here, get some leverage as I work into those areas. Coming out of this position is very easy. Just give a little lift on the knee, slide your foot out or your leg out, and then they're set up for a nice stretch. Bring the foot out to the side, position the side or the bottom of their foot on the inside of your calf right here. Press that forward so that their leg is nice and lateral to their body. Make sure the leg is not too far out like this, bring it in like this. From here, lift the knee, and you're just gonna pull outwards, and that's gonna stretch all these muscles in here. And then slide the leg back into place. I'll show you how to get a nice, quick and easy way out of this draping technique. So make sure this is untucked. You're gonna lift the leg up in the air like this, slide the top sheet through, grab the top of the sheet at 2 different places and pull outward like that. And the more you practice that, the quicker and more confident it feels. Your client won't even know what's going on with the draping. It won't matter to them at this point anyways. So here in the face-up position, the first thing I always do is get the client nice and draped before we start doing any movements. So, you don't want to go straight into lifting the legs or anything like that, because they can feel that it's drafty underneath, and we want to make them nice and secure. So we're going to go straight into the draping. It's the same thing as face down, where we're going to grab points, 2 points on the sheet, drape up just over the knee, and here I'm going to lift the ankle so the leg is nice and straight, reach underneath, grab a bit of top sheet, and just going to slide underneath the butt. Bring this up, tuck it. Same thing on the other side. And from here you can do some nice easy warm-up movements for loosening up the lower back, relaxing the nervous system, and they feel really secure here. Their brain, you don't want their brain to think about, even for a second, that they might be exposed, right? That's going to cause just, even the slightest amount of stress is not good. You want your client to feel really comfortable. So here we're going to do a calf stretch. So if you're working on the right side, your left hand is going to be the one that's going to be applying the pressure for the calf stretch. So whatever arm is on the inside, right? Just think about that. So if I'm working on the right side, my inside hand, my left hand, is going to reach underneath and wrap around to where the balls of their feet are on my forearm. From here, I don't even have to use my other hand. I can stretch the calf. Stretch. I'll show you on the other side as well. Really easy. Stretch. Stretch. But what I like to do is I like to get my their toes involved. So instead of just stretching the bottom of their calf, we're also going to stretch the muscles and tendons on the bottom of their feet. So you're going to grab with 2 fingers the big toe, and we're going to stretch their calf and pull up slightly on the big toe as well. And that's going to bring just another level of intensity to the stretch that a lot of people like. So stretching the calf and pulling that big toe. And most of the pressure is happening right at the base of the big toe, right in the ball of the big toe, right there. From here, their leg is up in the air, good transition to the next move, which is to lift their leg, bring your outside leg up, your foot's going to be right at their center line. You're going to drape their knee over your leg, press down, and lean your body weight back. You're using the leverage of your body and their body to create a really nice decompressive stretch that pulls the trochanter out of the pelvis just a little bit. A nice decompressive move, stretches that side of the lower back without using any of my strength at all. I'm just using leverage here. So leaning back, not pushing too hard down on the leg, right? All we're doing here is locking the leg in place so that you can do that lean without sliding out, creating any unnecessary painful pressure on the back of the calf. This is a sensitive part of the calf. And then some nice passive rotational movement. It's going to get that hip bone kind of doing circles in its socket. Feels very good, it's very relaxing. This is a good place to check the draping. Make sure the draping is nice and tight, so use your inside hand to pull right on that top sheet to make them feel really nice and secure as you go into a leg stretch, which can be a very exposing, sensitive position to be put in, but if you have the draping nice and tight, then you can move straight into a leg stretch. Make sure the foot is angled towards their midline, the knee is angled out, and we're pressing, making sure that that sheet is in place. All right, I'll show on the other side as well. After you do the leg hip decompressive move here, make sure the sheet is nice and tight. As we move into the stretch, pressing on the back of the hamstring can give support to the foot here with the inside of your leg, making sure drape is nice and tight. We're going to press towards their shoulder. From here, I've got control of their leg with the top of my wrist, top of my forearm, my hand placed on the bottom of their hamstring. And we're going to lift the knee up, lift their shin up, pull their knee down, and press down towards the table. Reposition your hand to the center of their hamstring and apply another press downward. And one more, a little bit farther down, and press. This transitions nice and smooth into the next step here. If you want to work into the groin muscle, keep their knee bent, put your knee on the table just underneath. And they're locked in for some elbow movements on the inside of the thigh. If you want to take this to another level, a more advanced level, bring their foot out to the side and you can do some pin and stretch movements where you'll press the side of this hamstring and you'll elongate the muscle by moving the ankle to the side. And you can finish with a stretch by pinning the other leg, supporting the ankle, and pressing to the side. Then coming back down to the center, doing some shakes. After all that intense stretching and pressing, it feels good to just get sort of wiggled out, pulled, wiggled out. Some nice easy stretches, relaxing moves. There you go. I do want to show one more move here. So this is a good stretch for just creating a lot of space along the side and in the back of the shoulders. So, lift the arm up, spread their hands out to the side, and tuck their hand right by the side of their head at the top of their shoulder. Once that's locked in place, ask them, make sure they're comfortable, this doesn't hurt their wrist or anything. And we're just going to press here, and we're going to press at the center line of the thigh. So I'm just going to lean forward and create a lot of space along the side. You can hold this for up to 20 seconds, 30 seconds, whatever you feel like. Shake out the wrists, and that's a good transition into working into the upper body stuff.